We had ward visit. There, our professor asked us to take history of patients and ask them what is their problem, from which disease they are suffering. So we went there. Then I met one patient there. From taking his history, I was not able to understand what problem he have. So I took his report and went to one of the resident there. It was medicine ward. So resident was present there. So I asked him what is the problem. Then resident told me that the patient is suffering from mitral regurgitation. It is some heart valve disease. So we are going to discuss about a tablet which was written in his file, which was continuously given to the patient, which was named as Lasix, loop diuretic, which acts on the loop of Henle, ascending limb of loop of Henle. And why they are giving this drug to the patient? Because when patient came to the hospital, patient was having pedal edema. Patient was having edema generally. His whole face was swelling. Whole face has swelling, and also he was hypertensive, as his BP was 170 by 110. So this drug is generally used as it decreases the fluid overload from the body, which simultaneously decreases edema and reduces blood pressure. So we are going to discuss about this Lasix, which is a loop diuretic. So this drug, furosemide, also known as Lasix, is a loop diuretic. It acts on the ascending limb of Henle, where one pump is present, which is known as sodium, potassium and chloride cotransporter. So this drug blocks this pump. As we know that along with sodium, water is absorbed in the body. So fluid in body is increased. By giving this drug, we are blocking this pump, which is known as sodium, potassium, chloride. So we are reducing the water intake from the body, and more water is released by the way of urine from the body. So we are decreasing the fluid overload from the body. So we are going to discuss what are the uses of this drug. Earlier we discussed about the mechanism of action of this drug. So we use this drug to reduce edema. It can be due to cardiac, renal or hepatic cause. It reduces edema by excreting more water outside the body. It can also use to decrease blood pressure in a problem of hypertension. Mostly we use thiazide group of diuretics for hypertension, but this can also be used. It can also be used to reduce the cerebral edema. Generally in cerebral edema we use osmotic diuretics, generally mannitol-like drugs, but this can also be used in cerebral edema. So there are some side effects with this drug, as it is decreasing the absorption of sodium and potassium. So obviously the level of sodium and potassium in body is going to decrease. So it is going to cause hypokalemia and hyponatremia. It is also increasing the excretion of water from the body. So some time it can cause hypovolemia. Volume of plasma or water in the body can be decreased. So this was about it, the drug Lasix. Okay.